By the end of my speech, I would like my audience to become more knowledgeable on the effects of meth addiction on the human body. Meth addiction is a serious condition which can lead to big changes in your life. What makes methamphetamine such an attractive high? Meth users report that after taking the drug they experience a sudden rush of pleasure or a prolonged sense of euphoria, as well as an increased energy, focus, confidence, sexual prowess, and feelings of desirability. However, after that first try, users require more and more of the drug to get that feeling again and maintain it. With repeated use, methamphetamine exacts a toll on the mind and body, robbing users of their physical health, cognitive abilities, their looks, their ability to experience pleasure. Here's how the body reacts to meth and the consequences of long-term abuse. Meth and the effects on the brain. Meth releases a surge of dopamine. Meth users have described this feeling as a sudden rush of pleasure lasting for several minutes, followed by a euphoric high that lasts between 6 and 12 hours. And it is the result of the drug causing the brain to release excessive amounts of the chemical dopamine, a neurotransmitter that controls pleasure. Meth produces the mother of all dopamine releases. For example, in lab experiments done on animals, sex causes dopamine levels to jump from 100 to 200 units. Cocaine causes them to spike to 350 units. Methamphetamine, you get a release from the base level to about 1,250 units, something that's about 12 times as much of a release of dopamine as you get from food, sex, and other desirable pleasures. When addicts use meth over and over again, the drug actually changes the brain chemistry, destroying the wiring in the brain's pleasure centers and making it increasingly impossible to experience any pleasure at all. Although studies have shown that these tissues can regrow over time, the process can take years, and the repair may never be complete. In addition to the affecting cognitive abilities, these changes in the brain chemistry can lead to disturbing, even violent behavior. Meth, like all stimulants, causes the brain to release high doses of adrenaline, the body's natural fight or flight mechanism, inducing anxiety, wakefulness, and intensely focused attention called tweaking. As you notice from this picture, you got a brain scan of control subject and one of a meth user. There's a pretty significant difference. One of the most striking effects of meth is the change in physical appearance of a meth user. Meth causes blood vessels to constrict. It cuts off a steady flow of blood to all parts of the body. Heavy usage can weaken and destroy these vessels, causing tissues to become prone to damage and inhibiting the body's ability to repair itself. Acne appears, sores take longer to heal, and the skin loses its luster and elasticity. Some users are covered in small sores, the result of obsessive skin picking brought on by hallucination and having bugs crawling beneath their skin, a disorder known as formication. In addition, stimulants such as meth cause tremendous bursts of physical activity while suppressing the appetite. An attractive combination for many people who begin using meth to lose weight. But while contemporary culture may idealize slim figures, heavy meth users often become frail. Day or week-long meth usage are usually accompanied by tooth grinding, poor diet, and bad hygiene, which can lead to mouths full, broken teeth, stained and rotting teeth. Here are some pictures of how meth changes the physical appearance of people. One photo is of a is the first jail photo they got, and then many years later is the other photo from a jail mugshot when she was on meth. Pretty significant difference. This is also a picture of one meth user from 10 years of mugshots. You notice the first one is pretty normal looking, and then they got a mugshot for pretty much every year after that, and you can tell that she increasingly just deteriorates. And then at the bottom, she actually died at age 38 of being addicted to meth. And then when we talk about tooth decay, grinding teeth, broken, rotting teeth, here's a picture of that. They call it meth mouth. Teeth are totally just blackened and are rotting out of your mouth. While a meth high makes users feel more confident, attractive, and desirable, the drug is actually working to make them unattractive, if you couldn't tell. One of the most dangerous effects of meth on the body is the increase in sex drive and the lowering of sexual inhibitions among some users. Meth puts users at risk for sexually transmitted diseases. Although meth is not necessarily an aphrodisiac, it does trigger the release of powerful brain chemicals that may increase sex drive, such as dopamine, which gives the user a sense of well-being and desirability, and adrenaline, which provides the user with a boost in confidence and stamina. Meanwhile, these chemicals impair the judgment centers of the brain. You tend to do things when you're on meth that you never would do sober. Unprotected sex is particularly dangerous for meth users, many of whom inject the drug and may share needles, which can spread deadly diseases such as hepatitis and HIV. Because the drug increases energy and stamina, users may have more aggressive sex for longer periods of time, increasing the chances of injury and the danger of spreading infection. In conclusion, I have informed you on how meth addiction can hurt and destroy your life. I gave you information and visual evidence on the effects of meth of the brain and the overall appearance. The best way one can prevent this is to educate yourself, family, and friends. Don't ignore signs of meth addiction. Take action before it's too late. The end result of meth is death.